Interesting medical story for the day. They're thinking about repurposing Viagra for Alzheimer's, and the data early on is actually looking somewhat promising. Let me explain. Actually, Viagra was first made for pulmonary hypertension, which is a type of lung disease. Incidentally, it was found that it also helped improve erection quality, and then you had the rebranding. As for this current story about Alzheimer's and Viagra, it was found from insurance databases that researchers were working on that if you were taking Viagra, your chance of Alzheimer's decreased by almost 50%. This was a retrospective analysis. It was not a clinical trial, but you can be sure that clinical trials are coming soon. In the world of medicine, it's better to have a hypothesis first and then do clinical trials as opposed to having data and then coming up with a hypothesis. Sometimes the variables become a little bit more confounded if you do it retrospectively. There's a theory that Viagra actually helps lower the tau protein as well as reduce brain inflammation, both factors that help reduce the chance of Alzheimer's. Funny enough, whenever I'm trying to help someone stop smoking, especially if they're young, I don't really try to scare them with cancer, because if you're like 25, by the time you're supposed to get lung cancer in your 60s, that's 40 years from now. Our cancer technology is exploding. I would be willing to make a $20 bet right now that in 40 years, we're going to have some amazing drugs for lung cancer. So I don't really use that as a scare tactic. What I use as a scare tactic is to tell them what happens to your erection quality if you continue to smoke, which is it gets bad. Like, it gets bad in your 30s and 40s. And that's usually good enough to help people stop smoking.